Hello everybody, Dr. Prakrita here, fertility consultant and obstetrician, gynecologist from Namrata Hospital. Let's discuss about bleeding during pregnancy today. So it is not uncommon to have bleeding during your months in pregnancy, but of course it is not normal to have bleeding. Any amount of bleeding, maybe it may be as little as spotting to heavy bleeding, has to be informed to your doctor. What are the causes of bleeding during pregnancy? Bleeding can happen because of very number of causes. Sometimes it may be just normal implantation bleeding, which happens roughly around 2.5 weeks after the fertilization process happens. So this may not necessarily be associated with pain, and patient may not yet be aware that she's pregnant. Sometimes a week after pregnancy has confirmed there might be mild spotting, and sometimes there may be heavy flow or passage of clots during the first 3 months of pregnancy. Always keep in mind that any amount of bleeding is not normal and it has to be taken note, and necessary precautions and treatment has to be given. Sometimes it may be because of a miscarriage that active bleeding is happening. It may also be because of some infection at the mouth of the uterus or because of some inflammation there. Some other causes of bleeding may, in the later parts of your pregnancy especially, may be because of placental origin. So any placenta that is covering the mouth of the uterus or is in the lower part of the uterus also can cause intermittent bleeding. Quite a few common causes may be because of some sexual intercourse or infection. It is also a sign of labor. So in the later months of your pregnancy, when you're nearing your end of pregnancy or where there is a beginning of the labor that happens, it may initially start with spotting or bleeding per vaginum along with expulsion of a mucus plug. For more such information, do contact us at Namrata Hospital. Thank you.